News. The Red Cross saying tonight local blood supplies so low it's now impacting surgeries, a crisis the likes of which they say they haven't seen in more than a decade. In a statement the local Red Cross sent to News 8, they said this, quote, "The Red Cross has heard from our local hospital partners that they are having to postpone procedures at times as a result of the dire blood supply challenges." Now, this comes as local hospitals are putting off elective surgeries as they try to deal with an influx of COVID-19 patients and people who can't get into nursing homes. Today, Rochester Regional Health sounded the alarm. Christian Garzone joins us now live outside of Rochester General with more on their plan. Christian, what can you tell us?
Well, Adam, this has been the story now for weeks at hospitals across the Finger Lakes region. Bed capacity is dropping more and more. Staffing is a serious challenge, and medical teams are using every inch of hospital space to treat patients. Today in New York State, the highest ever number of new COVID cases was recorded. And as we know across our region, we've seen a big spike in coronavirus cases causing major issues for area hospitals. Dr. Keith Grams is the chair of emergency medicine at Rochester General.
We are at capacity or well over capacity.
Grams says they can't get patients discharged who need long-term care, with some waiting on transfers to a nursing home.
And then we can have a large number of patients in the emergency department waiting for a hospital bed that have been admitted to the hospital.
Everything possible is being done, and he says every nook and cranny is being used.
You will see those patients in non-conventional areas such as the hallways.
Staffing is also a major challenge.
And I know staff are picking up overtime and an increased number of hours and then some.
Grams says the population needs now more than ever to slow the spread of COVID to bring these hospital numbers down. He asks all to mask up, practice good hygiene, and please consider getting vaccinated if you've not done so.
The overwhelming majority of patients admitted and that are admitted to the intensive care unit for COVID-related concerns are not vaccinated.
Now, he also said it's a good idea to get your flu shot if you've not done so. They're seeing admissions for that as well. Live in Rochester, Christian Garzone, News 8. Adam, right back to you.
All right, Christian, thank you. Back to the blood shortage for just a second. This is an area where many of us can help. If you do want to donate, you can schedule an appointment now by going to redcrossblood.org, or you can call 1-800-733-2767.